ever wondered if what you see on medical dramas actually happens in a hospital. Most shows prioritize romance and drama over accuracy, um, leaving healthcare professionals cringing exercise. But a select few series get it right, earning respect for their realistic portrayal of hospital life. Um, let's explore the shows that doctors say actually feel real. Scrubs often tops the list. Surprisingly, um, it's not just the humor, it's the brutally honest depiction of residency. Um, the show's writers consulted real doctors, ensuring cases uh, and treatments were medically sound. It focused on the learning curve, the exhaustion, and the strict hospital hierarchy, a refreshing change from the usual glamour. ER set the standard for fast-paced emergency room depictions. Michael Crichton, a doctor himself, grounded the scripts in reality. Um, the show didn't shy away from technical jargon or the chaotic nature of trauma medicine. Um, uh, Real nurses even served as extras, adding another layer of authenticity to the intense scenes. Uh, if you're looking for historical accuracy, The Nick is a must-watch, set in early 20th century New York. It unflinchingly portrays surgery before modern antibiotics. The show highlights the brutal reality, high mortality rates, and the experimental nature of medicine at the time, leaving a lasting impression. Major use. Hall the Midwife offers a unique look at midwifery and women's health in the 1950s and 60s. The series tackles complex medical issues with historical precision, consulting real midwives and medical historians to ensure accuracy. It showcases the vital role of community nursing in a changing world. This is going to hurt, pulls no punches. Based on a former doctor's memoirs, it offers a raw and honest look at the National Health Service. Uh, it exposes the extreme fatigue and psychological toll on junior doctors, uh, refusing to shy away from administrative failures and the unglamorous side of medicine. And Code Black draws inspiration from a documentary about the busiest emergency room in the US. The show utilizes a documentary style to replicate the urgency of real trauma centers, ensuring that medical procedures mirrored the chaotic reality of an overcrowded ER. It's a high octane look at a system pushed to its limits. Nurse Jackie focuses on the day-to-day life of an emergency room nurse, while also exploring her personal struggles. It highlights the bureaucracy of the healthcare system and the often underappreciated role of nurses, showcasing the physical and emotional exhaustion that comes with 12-hour shifts. Mass EH isn't just a comedy, it's a poignant look at mobile army surgical hospitals during the Korean War. And the show accurately depicts the meatball surgery required in combat zones and explores the psychological defense mechanisms doctors use to cope with constant trauma and death. It Bodies offers a dark and unvarnished realism rarely seen in medical dramas. set in an obstetrics and gynecology department plagued by negligence and cover-ups, it avoids heroic tropes, focusing instead on incompetence and systemic failure. The creator, a former doctor, infused the scripts with technical accuracy, getting on finds humor in the unglamorous world of geriatric care. Set in a women's extended care wing, it portrays the mundane, the bodily fluids, and the administrative red tape that define real hospital work. It's a surprisingly heartwarming look at a neglected sector of medicine. Chicago Med maintains a high level of medical accuracy despite its dramatic storylines. The writers draw inspiration from actual published case studies, and a team of medical experts remains on set to guide actors through complex procedures. It realistically balances trauma care and hospital politics. Combat Hospital depicts the operations of a multinational medical unit in Kandahar during 2006. The show captures the unique challenge of practicing advanced medicine with limited resources in a war zone. Producers work closely with military medical personnel to ensure tactical and surgical precision. The Resident distinguishes itself by focusing on the business ethics and bureaucratic corruption within modern healthcare. It shines a light on issues like insurance fraud and the cover-up of medical errors, accurately depicting how financial decisions often dictate patient care protocols. Critical sets itself apart with real-time storytelling. Each episode unfolds over 1 hour, mirroring the golden hour, crucial for trauma survival. The camera focuses intensely on the minutia of surgical procedures, offering a hyper-realistic view of the skill required to save a life. Saint. Elsewhere, pioneered the ensemble medical drama and offered a gritty look at a decaying urban teaching hospital. It addressed controversial medical and ethical topics and often showed doctors failing to save their patients, adding a layer of harsh realism. Transplant follows a Syrian doctor rebuilding his career in a Canadian emergency department. The series is praised for its accurate depiction of emergency protocols and the challenges faced by foreign-trained doctors, offering insight into the diverse perspectives immigrants bring to healthcare. So which medical drama do you think gets it, right? Let us know in the comments. And remember, if you're a doctor, you've probably seen enough medical inaccuracies on TV to last a lifetime. With that said, thanks for watching, and until next time.